So it is 4:30 p.m. Dr. Manoj Jain and Dr. Salil Bhargav, and it is time for us to start the program. There must be, a lot of questions in the minds of the STOs and the DTOs. What is going to happen, and what new have we brought for all of you? Well, all the STOs and DTOs present, first of all, grand welcome to you from the bottom of our hearts. And you are the focus of today evening and for every evening that we will meet for the next 2.5 months. So first, I would like to bring in Dr. Salil Bhargav. He is the co-founder of CETI, that is Collaboration to Eliminate Tuberculosis Amongst Indians. डॉक्टर सलिल भार्गव, मैं आपसे रिक्वेस्ट करूंगा कि आप आएं और अपना इंट्रोडक्शन दें.
Good evening. Thank you, Commodore Raman. Good evening, all my DTO friends, STOs, and our team. I am Dr. Salil Bhargav. I am Professor of Respiratory Medicine at Government Medical College, Indore, and I am, as Commodore Raman has informed, that I am Vice Chair Co-Chair of Collaboration to Eliminate TB amongst Indians. Friends, I would like to inform you also that I have also worked as DTO for 5 years when I started my journey. And since then, I am connected to TB program. And my dream is TB-free India, to make India TB-free. Over to Commodore Raman again, please.
Thank you, Dr. Salil. So today we are going to talk about team building and quality. Right. So Dr. Salil, आपके जहन में कोई अपनी जिंदगी का चैप्टर, कोई अपनी कहानी, कोई किस्सा, कोई एनेक्डोट आपको याद आता है जो आप टीम बिल्डिंग से या क्वालिटी से एसोसिएट कर सकें, जो कि हमारे डीटीओस को it appeals to our DTOs? Anything which comes to your mind?
Right. Commodore Raman, I know all the DTOs who are sitting here, we have passed through a very tough time when we faced COVID, when we were informed that the COVID has come. And all of us were roped in. Our TB hospitals were converted to COVID hospitals. And that was a time when it was a challenge for all of us to work together. And the most important thing was, because none of us were aware of what is the virus and what are the other things which we are going to face, the most important thing was to make a strong team. So everybody knows how important is the team making and how important is to come up with a good team. Because I know, आज आप जो टीवी नोटिफिकेशन के बारे में जो बात कर रहे हैं, उसमें भी एक सॉलिड टीम लगने वाली है. और इस तरीके से टीवी प्रोग्राम हो, कोविड प्रोग्राम हो, अस्पताल को चलाना हो, एनजीओ से बात करना हो, एनी टास्क, it requires a good team, a strong team, a well-trained team and well-informed team. उसमें ये सारी चीजें लगना बहुत जरूरी है. और मैंने आपको जैसा बोला कि when we came in front of COVID, we had to make a team. आपको अस्पताल चलाने के लिए चाहिए एक टीम, आपको लैब के लिए एक टीम चाहिए थी, आपको पेशेंट्स को कैसे ट्राइज करना उसके लिए एक टीम चाहिए थी, और न सिर्फ टीम चाहिए थी बट उनको ट्रेंड भी करना था, उनको ट्रेन भी करना था शॉर्ट नोटिस पे. So it is very, very important to have a very, very strong team whenever you are facing a challenge. And I see your booster TB notification as a challenge to all of us. I am from the side of DTOs along with you. हम सब DTOs के साथ मिलके, we want to make India TB free and it's a challenge for us. And when we go for this, we need a good, strong team. But Commodore Raman, मैं आपसे एक छोटी सी बात पूछने जा रहा हूँ. In fact, it's a challenge to you. मेरे को मालूम है नोटिफिकेशन कैसे करना. मेरे जितने डीटीओस यहाँ बैठे हुए साथ में काफी सारे मुझको भी जानते हैं. I also know them very well. हमारा रोज का काम है. मेरे ख्याल से आप किसी डीटीओ को रात को जगह के भी पूछेंगे आपका नोटिफिकेशन कैसा है, कितना चल रहा है, कैसे करना है. He knows it very well. तो आप क्या नई चीज हमको बताने जा रहे हैं अगले 2.5 महीने में जिससे कि हमारा नोटिफिकेशन बढ़ जाए? क्योंकि ये यदि आप हमको ये बता सकते हैं, we all are there with you for next not only 2.5 months but beyond also. So please tell us something.
Absolutely, Dr. Manoj, Dr. Salil, thank you for this question. And what I will do is, I will take a stand, and I said it in the inaugural session also, that I will always bat from the side of the DTO. Okay, and everything I will question, everything I will conceptualize, and everything I will present will be on behalf of the DTO. So in the inaugural session, we brought in some DTOs who shared their experiences and how they have benefited from whatever we do. But to answer the second part of your question, I think it is time for me to invite Dr. Manoj Jain. He has joined us from United States of America. It's early morning there. Dr. Manoj Jain, welcome.
Welcome. Thank you so much. Your DTOs ko bhi namaskar and welcome.
Thank you, Dr. Manoj. Dr. Manoj, may I request you first to give a very short, introduction about yourself, and then I will ask you, something very specific.
Sure. So DTOs, welcome. I'll be Subeki. It is at 5 in the morning here in America, and I'm with you. It is really important that we work on this. मेरी बातें हो रही थी DDG TB से. I was talking with DDG just the other day, and he gave his full-hearted support for our work. And for the past 10 years, I have been also working in the field of TB, have met with DDGs for the past 15 years as well. And we really believe that we can achieve this. And the key person is the DTO. It is the DTO that is going to be able to achieve TB free. Remember this, Prime Minister can't do it. Even SDOs can't do it. NGOs can't do it. It is the DTO who can do it.
Thank you. Thank you, Dr. Jain. Dr. Jain is the founder of CETI. He is also a faculty at Rollins School of Public Health. He is the one who has been visualizing the concept that we are going to share with you and what we are going to experience with you all. So, Dr. Jain, if I may ask you, would you like to share what can we expect from this course?
Absolutely. So I'm going to actually just show you in a graphic. अगर आप ये slide देखें, तो ये मैंने आपको पहले भी दिखाई थी. I've showed this before. You see, the pandemic has done a number on us. It made the number of notification in all your districts. If in your district you will look at what has happened, the numbers dipped. There was a little bit of recovery. Now, in the next 3 to 6 months, what we will see is the impact of boosting. So if you are wondering what this sessions is going to do, the expected outcomes are we're going to see that boosting back to the baseline and above that baseline. So I would ask all our DTOs, आप अपने monthly notification के numbers देखिए. ठीक है, ऐसी straight line रहेगी, it may not be straight, but you are going to begin to see that post-recovery boosting through our contacts and through a new tool. So if we can see the next slide, we can talk about how will increase. Dr. Salil said, you can even in your sleep tell us that notification, what is happening. But what we will be doing with you, sharing, is unique tools. अगर अपन कोई नया tool लाते हैं, technology लाते हैं, it boosts the productivity. So we'll be introducing a unique tool called ePDSA. PDSA, you will hear what it is in more detail, but electronic PDSA, weekly empowerment sessions, hand-holding contact engagement with counselors. So आपको अकेले नहीं रहना पड़ेगा. आपके साथ कोई रहेगा that will help you understand. And we'll track every week how notification is changing over the next 3 to 4 months. So we have shown this has worked. We have done 50 to 100 of these PDSA cycles and all have been successful. And this is the beauty. There is no extra time, no extra effort. This is what you are already doing and making that efficient. So Commodore Raman, I hope I have answered the key question that is on the mind of every single DTO. अरे मेरा time और लगेगा क्या? अरे मुझे और काम करना पड़ेगा क्या? ये another project है क्या नहीं है? No, this is part of the work that is being done, and it is to bring efficiency and effectiveness to what is being done. So that is the expectation, and this is what we have shown, evidence proven to work in the past 6 months as well.
Absolutely, Dr. Manoj. You have made it extremely clear. I would just reiterate it once again to the DTOs that we are not here to teach you anything. No, sirs and ma'ams, we cannot. We are here to share with you a knowledge of how to do something differently. A knowledge, a tool that has proven itself hundreds of times. And we promise you one more thing, that this learning that we are going to do will be lots and lots of fun. You probably will not even realize after an hour or so that so much of learning happened over the past 1 hour. So, with this promise, let us begin and let us move on the journey together and how to build a team. So, is it possible, DTOs? And I am going to ask this question to Dr. Manoj. Okay, but it is for you. Is it possible, Dr. Manoj, that without the government sanction, without filling any other vacancy, without doing any more HR recruitment, for me to expand my team, isn't it what is going to
Absolutely.
happen? Yes, please. What is your view?
Yes, there are many ways to expand teams. We have to be looking at what we mean by a team. We have to look at the function of a team and the formation of the team. The beauty of PDSA and team building is that given your resources, you can do more. You can be more efficient. So let us look at the team. What is a team?
Thank you. And here I am taking you back to our main slide. DTOs, today, your team is made stronger by CTD joining you, by CETI joining you, by Emory University joining you, by WHO consultants joining you, and by Indian Institute of Public Health, Gandhinagar joining you. So we are much more now. And what is a team? Team is a small number of people. We all know cricket team, football team, baseball team, basketball team. Some people come together, they make a team. They have a common purpose to win a match, to fight an enemy, to fight TB, to eliminate TB with complementary skills. Complementary skills, Dr. Manoj, could you amplify? What would it mean?
Sure. So अगर सोचिए अगर आप क्रिकेट टीम में हैं और सब लोग excellent bowlers होते या soccer टीम में होते and everyone was a goalie, it doesn't work, right? Everyone has to have different complementary skills to make it work. आपके DTOs आप हैं आपकी district team में you need TBHVs, right? You need a DTO, you need STLS, you need all of the different complementary functions. So आप leader हैं, आप DTO हैं, आपको ये देखना पड़ेगा कि किस तरह से complementary teams. And DTOs, you may be wondering that why are we talking about teams first? Because a PDSA cycle, the improvement we are going to see and happen will not happen until we get a team working on it. That is the critical element to success of any project, any PDSA, any notification.
Thank you, Dr. Manoj. So you brought two things very clearly to me. One is you said that the teams must be complementary, like a cricket team. There is a need for batsmen, there is a need for bowler, there is a need for good fielders, there is a requirement for a wicket keeper. And these team members should hold each other mutually accountable. In the sense, your failure is my failure and my success is your rejoice. So far I have understood, just the smallest number of people with a common purpose, like say husband-wife. Husband-wife is probably the smallest number of people, and their objective is, prosperity of the house, well-being of the family, health of the family, growth of the family. I think that's the best example of a team.
Absolutely.
Okay. So let's move a bit further. You said, that the job requires multidisciplinary skills, and you brought me the example of cricket. So isn't that a group? How is a group different from a team then?
So a group, imagine this, has the same set of skill sets, right? You have a group of DTOs who get together. Imagine, can 50 DTOs do for one district? No, because they all have the same skill sets. You need the TBHVs, you need the STLSs. Same thing, a group is people of the same skill set. We are looking in a team, a group of different skill sets. That is where you have to, as a DTO, discriminate. What skill sets? The reason we're saying this is because when you begin to improve notification, you're going to have to be very discriminatory. Which skill sets I need and which people I need in the team. Doing complex tasks with a single purpose. That is our objective with that team.
Okay.
And
yeah, sorry, I interrupted you. Go ahead, please.
No, and then we just bring this differentiation so you understand the difference between a team and a group and focus in on the team.
Okay, so Dr. Manoj, I am understanding group, team, multidisciplinary, but we are a poor country, Dr. Manoj.
I know.
Our DTOs, they don't have all the manpower. They want, very, very efficient team members, but they do not have that quality of people. The workload on them is very high. The burden is very hard. You think such a under-resourced, burdened team can perform? Does some example come to your mind that you can share?
Absolutely. I remember my favorite movie is Lagan, and that shows how under-resourced situation we can overperform. And you remember Bhuvan, how he pulled together the team. And when we get together in a team, something magical happens, something catalytic happens, right? It's like an enzyme reaction. It brings people together. It generates those hidden energies that are there. It supercharges us. So I want to share with our DTOs this feeling of what happens when the team gets together. Commodore Raman, you find it absolutely amazing that across the world, people use this movie as an example of how to build a team. And I would say the same. The DTOs, you are the Bhuvans of the TB program. You are the ones who are bringing together this diversified group of people in your district, and you're making things successful. What we are doing is talking about expanding that idea.
So I have understood, Dr. Manoj, that, in the first session itself, we are focusing on teamwork. And there is something we believe very strongly in DTOs. We believe that strong teams make strong DTOs. So when we will be doing this journey with you, we will not be focusing only upon you. We shall be focusing upon your teams to make sure that there are certain skill sets that if they didn't have, we will make sure we impart those skill sets to them. We will make sure that your team becomes very strong and supportive, that it is able to fulfill your vision and your dream. So it is not that we are going to ask some objectives and some milestones from you that, you must do this. No, that is not the objective. What we are looking at making our teams. Today, we are trying to make a team with you. All of us are becoming a team by discussing. As we move forward, we will make teams under you, with each of you having a representative from our team as well in the form of counselors, the boys and girls who have been in touch with you for the past 5-6 years, guiding you, sharing the link for the meeting with you. They will be your single point contact and they will help you form your team. So, Dr. Manoj, tell me, if I have a member short in my team, suppose I don't have a TBHV, I don't have, say, a data entry operator. Now, what do I do? Shall I keep waiting for the government of India to fulfill that vacancy? Or should I look for talent with what I have? Is it possible that I will find a DEO from within the kitty of staff that I'm holding?
Absolutely. So I think we can look at an example. We can look at a case study. Again, there are many people who are multi-talented and who can cross cover. And that is where a leader comes in, where he or she sees the talent within the group and then uses that. So if we have an example, if you remember from our movie again, if you would play that, that would be important.
I think you are remembering Kachra.
Yes.
You know, the guy who used to throw the ball like this.
Yes.
And yes, and his talent was discovered. Let's have a look at the clip first.
Yes.
Over.
Notice how Bhuvan sees this, and all of a sudden, everything changes. Everything changes.
Absolutely.
And he has faith. He has faith in his team members. That is so critically important. Just as your STO has faith in you, just as DDG has faith in STOs, just as all of that is so critical, you have faith and develop faith and relationship with your team members to build them together. That is what success will, that is when success will occur.
So let me just help DTOs. You know, I said I will always bat from the side of the DTO. Okay. So let me just do a recap for them, recapitulation. You said a team is a small number of people. Okay. Smallest can be 2 with a common purpose. So objective is to increase the TB notification. That is my common purpose.
Yes.
Okay, fine. And with complementary skills. So when I'll make a team, there will be a STS in that, there will be an STLS in that. We will put in a TBHV also. I will focus on a specific area in a TU or in a block where, you know, I need notification to grow up. I know the cases are there, but the notification is not happening. So I'll pull in some ASHA worker also from there. I am understanding all that. And you know, we will be mutually accountable. You think that is all which is enough? I don't agree with you. I don't think so. This may appear very philosophical, you know, Lagan and all these things. Let me counter your argument, Dr. Manoj. So that, you know, because there are many DTOs right now who may be, you know, having various ideas in their mind. So to your Lagan, I bring in a counter argument by sharing with you a clip from movie Sholay.
Aha, very nice.
Now here we will see a very sincere leader. You may see a DTO, okay, and a team of 2-3 people committed, common objective, but yet they will not be able to deliver. And I challenge you.
Okay, let's see the clip.
Why is he not helping, Dr. Manoj? Now you said the small number of people together. So the answer is he did not have the arms.
Right.
He did not have the delivery tools.
Right.
So DTOs, we are coming to the main point of our discussion, that what we'll be sharing with you. You know, we have the skill set as a DTO. We have the knowledge. We have the sincerity. We have the intention. We want the TB notification to go up. But somewhere our approach is not appropriate. Is it our mistake? No, it is not our mistake. It is just that in our course of our careers, we have not been introduced to certain tools and certain apparatuses, certain mechanisms which can make us work with 10 times more efficiency. That is called PDSA. So that is the tool that we will share with you. That is the delivery tool that we will share with you. which will make your intentions work. Yes, Dr. Manoj, would like to add something?
Absolutely. Tools can make all the difference. So if you are wondering what new skill sets, what new knowledge, information that you will gain, this is what will be one of the key elements. Yes, apne team building ke baare mein baatein kari. You have learned and seen and realized the importance, why we have begun with that concept. And then now we want to introduce the tool that will make the difference. In fact, this is the tool being used across the world. In Europe, in America, the Plan, Do, Steady, Act quality improvement tool, that has been the focus of how one improves quality. और अपन बातें करेंगे कि अपन को why करना है, why do we need to do this, and then bring it very quickly into how to do it as well. We don't want to spend too much time on the why, but then how to do this. And this is the new information that you will be gathering and using it for a lifetime.
Thank you, Dr. Manoj. Thank you so much. At this point in time, we enter our guest faculty segment. DTOs, this is a segment we have added. And herein, we will bring all the DTOs who have experienced this tool with us. There are some DTOs amongst you who have done this journey with us partly, and now we are focusing only on notification. So here we have with us Dr. Lokesh Gupta. He is the DTO of Muzaffarnagar, and he's got an experience of 7 years being MOTC. So I bring in Dr. Lokesh. Dr. Lokesh, can you hear me?
Yeah. Good afternoon, everybody.
Good afternoon, Dr. Lokesh. Dr. Lokesh has recently been awarded with the bronze medal at national level on 24th March on the World TB Day. And there are many things which I would like to know from Dr. Lokesh. Dr. Lokesh, your topic for PDSA that you have selected is working on increasing the private notification in your district. Am I right?
Yeah, yes, sir.
So, see, everybody is looking towards that. Every DTO is wanting to increase the notification. So tell me, what is new that you are trying to do with this approach of PDSA? And I am very simply asking you for the benefit of other DTOs who are attending this program, that, what is your learning from the PDSA approach and what are you going to do?
Sir, first of all, thank you, SETI and all the host agencies, and welcome all the STOs and DTOs on this platform. I am glad to share the chair with all the faculties. In fact, sir, perhaps I was doing the things in a different way before PDSA. Everybody wants that private notification must increase. But मुझको लगता है कि PDSA is a scientific way how to improve the things, how to keep the records, and how to intervene mid-term to get our target achieved. So once I joined PDSA, it was like ठीक है, बहुत सी training होती है, plus minus join करते रहे हैं. But now from February now, if I miss one session, I must I really ask my QIC ki please send me that session. So I have become addict of this training, which I am doing simultaneously with you, sir.
Thank you so
Hello.
much, Dr. Lokesh. Yes, thank you so much.
Yeah, thank you so much. So you have made a point that you are always working towards increasing the notification. But this approach is scientific. This approach is different. This helps you monitor the progress. This helps you, delegate the work. This helps you build the team and keep the team together. So one more question I have got for you, and again for the benefit of the other DTOs. By any chance, following this PDSA approach, has your burden increased, or are you taking more time to do some job, or are you putting more energy, or it is reduced? The time is reduced, the effort is reduced, the energy is reduced. Your views, please. Okay, I think we've lost him. So with this,
Am I audible?
Yes,
Yes,
Dr.
yes.
Lokesh, please go ahead.
Yeah. No extra time I have to devote for this training on PDSA, but definitely PDSA, I want to share. PDSA came, we try to develop, I develop one algorithm chart with persons nominated. I make a team of persons who visited the private practitioners to enhance the private notification. And today I changed the background of my this video with bridge. So I am working like a bridge of two ends of private and public patients. Those patients which were not coming to our system, we have to work like a bridge. So that's why I made this background of bridge. And with the algorithm chart and persons notified, there could be a long session कि हम किस तरह से उस पर work कर रहे हैं और वो हमारा एक study भी चल रही है or different ways. And definitely I will congratulate your team and QICs which are working marvelous with all of us.
Thank you, Dr. Lokesh. You make it very
Thank
easy.
you.
Dr. Pratibha, please start sharing the screen. I will request Dr. Manoj to make a statement, and then Dr. Lokesh, please do not go anywhere. I am
very much here.
I am going to call you again because there is an app that you have made, and I want everyone to see that. So after the quality improvement session, I'll call you again. Dr. Manoj, your
So
views.
absolutely, yeah. So Dr. Lokesh, thank you. Sub DTO say I want to say this. You can see the impact of the PDSA on a DTO. There's no reason why the same impact will not happen, if not same or better in your district. So let us begin that conversation. That what is the tool? What is this quality improvement approach? The innovative approach, right? You bring innovation. Apan iPhone late hain, it brings innovation into. Apan WhatsApp late hain, it brings innovation and efficiency. So I will introduce my co-faculty here, Dr. Pratibha Kohli. She is a renowned expert in quality improvement. And Dr. Pratibha, welcome and delighted to have you have our conversation with our DTOs on quality improvement.
Thank you so much, Dr. Manoj. So I am so excited to share about quality improvement. It is, people think that it is very different, but it is so easy. We know that we are doing it in a day-to-day manner, but we have to be a little bit scientific. So let's understand what is quality improvement. So you have seen this, Dr. Manoj. Why
Yes.
quality improvement is important means we are going fine. You have seen this chart before. So why quality improvement? Why why we are doing this? Means for what is the exercise? Can you just throw some light on it?
Absolutely. So if we do nothing, DTOs, we will be on that red line, that 1.5% decline every year. But our Prime Minister, our elected leaders, our STOs have all given a directive. We need to decrease significantly, 5%, 10% a year, our TB incidents. And we will only do that by having our notification reach at a level and then see the decline. And so we have to inject the new tool. And that is what we're doing, injecting a new tool in over 500 DTOs have joined the initiative, and we will see that their performance will rival those who have not. And we will see that a new tool, how it will change. You'll see that boosting curve happen for that group. So what we're saying is we need a new tool to inject in the present rate so that we can reduce TB incidents and increase the notification.
Amazing. So you are saying that we need to introduce a new tool, but why are we not able to reduce TB incidents?
Yeah. So this is actually, very good question. Yes. And if you look at the next slide, what we know is the following, that at a global level, if you go to the next slide, that we have access to all of the health services. So if you look at TB health services, they're readily available. It's like a chair. Our health system for TB health system, we have apne paas access hai, so, PHCs hai and all that. And cost, it is free for cost. Everything is there. What the scientific evidence is saying is we're still working on getting the quality. And so we have to improve that. My question to you is, if that is the case, then Dr. Pratibha, let us ask the question, what is quality in TB then?
I think quality means we all know what is quality in different way. Means if you buy some good car, you check the quality and you have indicators to it. So similarly, if we talk about quality in TB, the simple indicator is TB free India.
Yeah, if you do the next slide, I think that is where it makes it all very clear.
So
अगर अपन बहुत simple words में करेंगे, अगर अपन TB free India की बातें कर रहे हैं, that is quality. Providing the right care for every patient every time is what quality is in TB, and that will reach TB free India. That is perfect.
Absolutely. Like we say, whenever we explain the quality concept to healthcare people, we say, जब कोई नहीं देख रहा है, right quality आप तब deliver कर रहे हो, is quality delivered. So we have to innovate proven quality improvement tool to get TB free India.
Dr. Chitra Durga, DTO Chitra Durga has asked a question. Quality in terms of what? Beautiful question. So
yes. I can absolutely, and thank you so much for asking those questions. So you see, what we did is quality was put in terms of quality measures. And we have different types of measures. Apan batein karenge with outcome and process measures. So when quality can be a very fuzzy, cloudy thing, but now we take that cloudiness and put it into concrete measures. And CTD has done that. TB notification is the major measure. Your subnational awards, a majority, 20-30%, are based on that. And that is why we are focusing on that very measure. And so
that's the impact measure, in fact.
Yes.
So when we, DTO Chitra Durga, when we do this program at the national level, we look at the quality of the policies. When we do it at the state level, we look at the quality of the processes. When we are doing at district level, we are looking at the quality of implementation of the TB program. That is why you are the chosen member, because you not only are connected to the field, to the patient, but your feedback is seen and it helps derive the policy at the national level. So that is what makes you the most important member of this entire link. And that is what we will do when we look at the quality. Yes.
Absolutely.
Absolutely true. So now the question is, we understood the quality, we understood that we need to have measures to measure the quality, but we are talking about we need to have an innovative tool, which we are talking about quality improvement tool. So what is quality improvement tool? Like our DTO Dr. Lalit said, that it is nothing, it is a systematic scientific approach which is based on evidence, and it is absolutely data driven using the PDSA cycle. It's a business approach used by many industries. Yes, it is a new in healthcare, but the aeronautics industry, your motor industry and assembling industry, all of them are using this. And now we are introducing this into healthcare so that we can be scientific. Yes.
Yeah, absolutely. Yes. And I'll ask if Dr. Salil may want to add on this as well, his experience and how 10 years ago, he was in US at IHI, Institute of Healthcare Improvement meeting, and he also learned these skills and applied them and has been applying them in his work. And this whole quality improvement tool really comes from the Toyota principle, from the basics of what we find businesses are doing. If you look at any business, what they're doing is a PDCA, Plan, Do, Check Act, or Plan, Do, Steady Act. So that is there. So Dr. Salil, if you'd like to add a bit of your experience, and then we will go a little bit into detail, how quality improvement is different from the quality assurance, which we have been doing. It is important to discriminate. जैसे अपन ने पहले teams or groups में discriminate or separate करा, अपन quality assurance or quality improvement में will discriminate. So Dr. Salil, if you're there.
Okay, thank you, Manoj. I've been listening what quality is. I'll tell you a very simple example. मैं बहुत छोटा सा example देता हूँ. अभी कोविड के दौरान हमारा जो टीबी हॉस्पिटल है, इट्स अ गवर्नमेंट हॉस्पिटल है इंदौर, तो वहां पे सारे लोग आते थे क्योंकि कोविड के टेस्ट और कोविड का जो ट्रीटमेंट था वो एक बहुत स्पेसिफिक हॉस्पिटल्स में था इनिशियली. Few of the military personnel came over there. Commander Raman, please listen carefully. So they came over there, and when they were looking here and there, right and left, and one of them asked some of my peons who were standing over there, "Is it a government hospital?" You know, that tells the quality. मैंने बोला यार आपको क्या ऐसा लगा जो मैं बाहर आया था निकल ही रहा था. I asked them what is. बोले साहब साफ सुथरा अस्पताल, कुछ प्लांट्स लगे हुए हैं, कोई अच्छी बात कर रहा है, बैठने की चेयर्स हैं. क्वालिटी एक अलग चीज है और हम सब अच्छी तरह समझते हैं, बट वी नीड टू इम्प्लीमेंट इट इनटू आवर प्रोग्राम टू बूस्ट इट. दैट इज माय सिंपल सजेशन. वन थिंग, Manoj, you told me about talking about IHI. Manoj, and because of Manoj, I was introduced to one of the institutes, international health institute. This is based at America, who teaches quality cycles and quality improvement procedures to the American doctors. मैं 2 या 3 दिन के लिए वहाँ एक फेलोशिप के लिए गया था 2006 में, and in fact that was my starting point for understanding, learning, loving quality. और तब से मैं कुछ क्वालिटी के बारे में थोड़ा सा समझने लगे. बहुत सिंपल चीजें रहती हैं और क्वालिटी का मतलब बहुत बड़े बड़े काम करने की कतई जरूरत नहीं है. आप, मैंने जो बोला, प्रतिभा ने बोला, मनोज ने बोला, आप जो कर रहे हैं उसको थोड़ा सा बेहतर तरीके से कर सकते हैं. दैट वाज द आर्ट वी लर्न फ्रॉम देम, एंड फ्रॉम देम वी लर्न कि किस तरीके से हम यूटीआई बंडल्स यूज करके यूरिनरी ट्रैक्ट इन्फेक्शन को कम कर सकते हैं, कैसे हम एयरबॉर्न इन्फेक्शन को कंट्रोल कर सकते हैं, वह कैसे, और वहाँ बातें कौन करते हैं, वहाँ सिखाने वाली जो फैकल्टी हैं, वहाँ पेशेंट्स के अटेंडेंट हैं, जिनके दोज हु हैव लॉस्ट देयर पेशेंट्स बिकॉज ऑफ सम सिंपल रीजन, जो एक मेडिकल का कहीं लैक्यूना रह गया. एक मदर खाली ये बताती है कि मेरा बच्चा जो था उसकी डेथ इसलिए हो गई थी कि उसको डिहाइड्रेशन हो रहा था, उसका वेट रोज कम हो रहा था आईसीयू में, बट नोबडी वाज एबल टू पिक इट अप. तो बहुत छोटी छोटी सी चीजें हैं. यदि आप केयरफुली अपने प्रोग्राम को देखेंगे और उन गैप्स को फिल करते जाएंगे तो आप क्वालिटी की इस हमारी जर्नी में न सिर्फ चलेंगे, आप सिर्फ दौड़ने लग जाएंगे. और बूस्ट नोटिफिकेशन का जो बूस्टिंग है, ये तो एक बहुत छोटा सा प्रोडक्ट रहेगा आपके साथ, बट इसके साथ आपका टीवी प्रोग्राम 360 ग्रो अप होगा और आपको मजा आएगा. आपके एसटीओ साहब और आपके डिस्ट्रिक्ट लेवल पे हर कोई आपको अप्रिशिएट करना चालू करेगा. Manoj, thank you very much for allowing me to talk. Yeah, sure.
Yeah, thank you for sharing. You see, these small personal experiences go a long way, and you DTOs will be having those personal experiences as you go in this 2-month journey, and that is really important, to go in the journey together. You are here, dedicate the time and the effort. I see that DTO Rohtak also has raised their hand. Commodore Raman, whenever, if we need to, we can have DTOs also share their questions. Otherwise, we'll go into the quality assurance and quality improvement slides. So, great. So,
Okay.
Dr. Pratibha, yes,
Yeah.
let us talk about the difference. Ki ye quality improvement, how it is anything different from what we are already doing?
Yeah.
So,
Dr. Manoj, you must have heard about quality assurance a lot of time. Means
Yes.
whenever we are buying some electronics, we can see on the package quality assured. Okay, the tick mark is there, but we have never seen the quality improvement tick mark on the electronic things. Okay, so what is assurance? It is basically ensuring is it's pass or fail. Simple. Okay, so in quality assurance, we focus on individual things. We believe in perfection, whether it is pass or it is fail. It is the fallibility is not recognized. Means we don't, in quality assurance, we don't believe in improvement. We believe in it is pass or fail. And we believe in solo practitioner. Means if I am talking about quality assurance, I want to improve quality assurance, I don't need any team. I can do it myself because I just need to make pass and fail. And peer review, because I'm doing by myself, peer review is most of the time ignored. And the worst thing in quality assurance concept is we believe in punishment. If you do something wrong, if you fail in the process, or if you have the variation in the process, the reprimand will be there, which is not there in quality improvement. Like we said, it is a beautiful scientific tool. We focused on system, how
Mm,
systems are working, what are the processes, what are how my team is working, what my team is thinking, what brainstorming we need to do on a particular problem. And peer review is equally valued, and errors are seen as opportunities for learning. They are not seen as a punishment. So that
I
is what
see.
we call quality improvement. Day by
So,
day we improve from the previous day.
so in the next 2 months, what I'm hearing is that we will focus on quality improvement on this one measure of quality for a district, and
Yeah,
that is TB notification, public notification and private notification. And that is what we're going to see improve, right? So what I like the graphic tremendously. Quality improvement it doesn't mean that only a small group of people get improvement. It is the entire group. All of India is going to go towards that improvement. And
absolutely.
what we will see is the number of TB cases over time will decrease as we work on finding all the TB cases now. So that is the beauty of a quality improvement approach.
So,
So, comment, yes,
so
go ahead.
Dr. Manoj, I want to take permission from you.
Yes,
This is a little heavy subject. We need to add
yes,
some spice. So I'm just gonna call Commodore Raman
yes, please.
for
So my
explaining
so so
quality assurance
my
versus
status
quality
my
improvement.
status in our organization has now reduced to bringing spice to the
Oh yes.
session. Okay.
And bringing great examples as well. क्योंकि क्योंकि
Yes.
अगर theory होती है तो मजा नहीं आता है. When अपन
Absolutely.
examples of personal stories सुनते हैं तो वो stick करती है. So that is why we are sharing these examples.
Okay. So Dr. Pratibha and Dr. Manoj, I said, no, I will always bat from the side of the DTOs and I'll try and make things more simpler. Okay. Because we promised them no strain. They will go happy hereafter having learned. So you said quality assurance is pass and fail. You
Yes.
said that the good things will go through and the bad things will be stopped.
Yeah.
Fine, perfectly fine. So this thing has been practiced in our country tens of thousands years ago. Quality assurance. You don't you remember when Lord Ram went to the jungle? What happened when he met Shabri? I will tell you example of quality assurance. Can you please play the video of Shabri ke bear? So clear, very nicely brought out that this is quality assurance, that only the tasty fruit, only the sweet fruit has been tasted and offered to the God. So only the good things will go to the patient, only the good things will go to the customer. Okay.
Correct.
Even if the bad is being produced, the production of the bad will continue. But we are only doing quality assurance. We are checking it at the end and not allowing the bad to pass. So
Right, that's really important concept. That what happens is we name, blame, and shame in the quality assurance model, right? What we're saying is you got to think differently. It is not a black and white. We need to all work towards improving. And there's no room for name, shame, and blame in improving things.
Okay.
Only so Ramanji, I have this thing. You have beautifully, introduced the concept of quality assurance. How you are going to introduce quality improvement, Samba?
Okay, fine. So you said that quality improvement, first you do the analysis of the problem. Okay. If we failed, why did we fail? That is right. You said we'll do analysis. And then after doing the analysis, we will take action so that that mistake does not repeat itself again. Am I right? To improve quality, to understand quality improvement? Okay. So let us look at another clip. Okay. And this is only for fun to keep the quality improvement in mind. Okay. So we'll first do the analysis of the problem.
RCA.
कितने आदमी थे सरदार? 2 आदमी। आदमी।
Well, I think the video didn't play.
The video may not have come through, but tell us, Commodore
Yes.
Raman.
So Gabbar Singh first analyzed the problem. Why did you fail despite you being 3 and the enemy opponent was just 2? And thereafter he shot all the 3. Okay. You think anybody in his gang will ever come back khali hath? Okay.
No
So
way.
that is what, are you trying to say that, we must take, of course, we should not shoot people. That was the fun part of it. But yes, I understood the point that quality improvement is a process, that in the process itself, you take action so that the problem does not repeat itself forever. So great. So I have understood what is quality assurance, and I have very clearly understood what is quality improvement.
So let us talk about how this is going to help us. Let's bring it down to the activity level and then how we are going to do the quality improvement process. So let us, Dr. Pratibha, go through that and share some examples.
So when we are talking about how we have to improve the quality and how it will help us, basically it helps us in many ways, but we are here telling you about four major things. It helps us in standardizing, basically helping us to make the checklist to reduce the process variation. We are human beings, we tend to forget. So if we are jotting down, if we are making the checklist, we don't forget because everything is in front of us. And if we say, like we said that quality improvement is not a single person focused, it is a team based. So if we are sharing the problem with the team, then it is so different. We are brainstorming, we can get multiple things open and we can have the solution on the table. So that is the power of quality improvement. And we have to always believe in system. See, we believe as a layman, we believe in this is the problem, this is the solution. But here we are saying no, we are saying you have to be system based approach. You need to take, you need to think through, you need to brainstorm, you need to talk to your team, and then we have to come to a solution which is right there. But it is only possible when we talk. So self-reflection and self-improvement is a must. So this
Absolutely.
is yeah.
So let's take a look at a video again of how this can help us better understand. Then we'll go into depth. हम आपको video इसलिए दिखा रहे हैं because it will give a broad concept, but then we will go into the depth. And if you have questions, I know there's lots of conversation in the chat group. Please send a question to us. Commodore Raman will put that question to the group. So Dr. Pratibha, let's share us a video and ask us what we are learning. I remember this as a child.
Yeah, nostalgia.
Yes.
हाय राम, और वहाँ व्याध ने एक जाल बिछाया था। व्याध कौन दीदी? व्याध चिड़िया पकड़ने वाला। फिर क्या हुआ दीदी? व्याध ने उन्हें पकड़ लिया, मार डाला।
There was a solution.
Yes, Jugat.
छोटे हो पर मिले रहे तो बड़ा काम भी होवे भैया, बड़ा काम भी होवे भैया। 1 2 3
Team approach.
चतुर चिड़िया, सयानी चिड़िया, मिलजुल कर जाल लेकर भागी चिड़िया
So, Dr. Manoj, I always relate this like Shikari is the TB and
Yes.
Chidiya is us. So we need to put a jugat innovative idea, which is quality improvement. With the help of quality improvement, we can actually become TB free. That's what we believe in.
Absolutely. So that is how in a team approach and putting mind, reflection, and putting those in.
Yes.
So let us go into the model itself now. I think it's really important we talk about this because over the next 2 months, DTOs, आप ये करेंगे counselors के साथ, and you will be doing this to increase the notification. So what the model is that there are 3 questions you will be asking. Fundamental, what are we trying to accomplish? We know that very well, to improve notification. How will we know that the change is an improvement? We will see that rise, that boosting curve. What
True.
change can we make that will result in improvement? That is going to be a question that you individually and your team together will be making. And then you will follow a plan, do, steady, act. I think that is what is the what's of quality improvement.
True. Always we DTOs, we need to remember these 3 fundamental questions before we start with the PDSA. So if you remember that, your half job is done and you are already proceeding towards the PDSA cycle. So
Excellent.
PDSA, like Dr. Manoj said, it is plan, do, study, act. It is in action-oriented learning. It is continuous and incremental improvement. We are not finding faults here. We are improving every single day from previous day. And it is performed repeatedly and in a small steps. So we improve. You will not get to know, but you will improve. That is the beauty of PDSA. What do you say, Dr. Manoj?
I think that is the key in there. And then if you look at it in the next slide, it is a action-oriented process. It is continuous, it is incremental. And what we see is that it's performed repeatedly in small improvements. So that is critically important. And each element, हम आपके साथ work करेंगे, and we will apply this to TB notification. But we have simplified it in a basic 10 steps to designing a quality improvement project. And what these are the 10 steps that you will be doing. First is go ahead.
Sorry, please, you go ahead.
Yeah, so we'll be identifying a problem. That is a key here. Our problem is very clear that with the pandemic, we saw a decline in the number of notifications. We have to address that.
True. So when we know the problem, we have to develop an aim statement. We will help you in developing the aim statement. You will be doing in your next BTN too. And when we develop the aim statement, when we put it, when we write it, what is the aim, where we want to be, then we will start collecting the baseline, the data. Like we said, we need to have the data before we proceed because it is absolutely scientific tool, and scientific tool needs to have the data. So we will collect the data. What was there previously? What is your notification level previously? That's what we are going to collect. And after collecting it, we will identify the process and outcome measures. Means we are going to identify where what is the process chart, where is the blockage, where is the bottlenecks. So we will find out the bottlenecks and we will try to make the measures, and definitely will get the outcome measures accordingly.
Absolutely. Dr. Pratibha, aapne bola baseline data. I think if you look at that graphic that I shared with you, that if you track monthly since 2019, and I had shared that slide with everyone during the inauguration session from Indore. Yes, it's a little raggedy, but you saw the curves, how it came down. We want you to develop that slide for your district. And we want to share that then with everyone here as well. So bring in and create that slide. We have a template that all you need to do is feed the data and you'll get the baseline. And so the key steps, we said we are data driven. Key steps in our 10 steps is data driven. Next, we go to the next set of steps, right? Let's talk about root cause.
So root cause, like you have seen these Sholay video, the root cause. What is the problem? Why it has happened? So we have to go in depth. We need to find out why it has happened. So we have different tools to resolve that problem, to find out the problem, like fishbone and 5 whys. So our QICs will get in touch with you for that, and definitely we will be covering in the next session about the root cause, and you will be finding it very easy that it's there. Just we need to gather on the piece of paper, and solution is there. So root cause analysis, current state analysis, and process mapping. Once you do the root cause, you can map the process. It's such a wonderful thing. You will see your entire process on a piece of paper, and you can find out that where is the problem, what I need to do, what all interventions I need to take, what all brainstorming I need to do to make the plan working. What do you say, Dr. Manoj, about this?
Yes, very much so. Or you must be thinking this is so much work, but I promise you it is not. It is a simple step-by-step process. And then we do the implementation and we see the results. We decide whether we're going to adopt, adapt, or abandon the approaches that we have done. And then we standardize those things. So these are the given 10 steps in designing a QI project. And the counselors will share with you documentation of how this is all been scientifically shown and proven. We have articles we have written in multiple places. Or मैं ये भी बताऊंगा कि I have also done the PDSA cycle as a personal level. So in Annals of Internal Medicine, I write about how some years ago, our marriage had been on the rocks. It was going in a difficult situation, and how we used, my wife and I specifically used PDSA cycle, and we're successfully and happily still married. I will tell you, Dr. Pratibha. So
beautiful. So now I think we have a time for polling. So computer ji, can we have a polling question on our screen?
Great. So this is a great idea. Let us engage our DTOs and let us ask a simple question about what we have been talking about, right? Quality improvement is systems thinking and protocols and checklists, a team process. It involves self-reflection and measures, or D, all of the above. And so DTOs, time to participate, share what your thinking is, what your learnings are. And I see, great. We can do more polling questions. We enjoy your engagement and your ideas being shared here. And so this is excellent. Dr. Pratibha, I believe all of our DTOs really understand this concept very well. I think it's going to be important कि अपन एक DTO जिसने successfully करा है, who has done this cycle from the beginning to the end. We would love to hear from them as to what their experience was. So DTOs, you must be wondering that how can we do this much effort, work, and will it be successful or not? But we will share with you experience with Dr. Chandresh Vyas.
Right. So before we move on to Dr. Chandresh Vyas, we like to announce the result. The results of polling questions is D, that is quality improvement is system thinking with protocol and checklist. It is a team process also. It involves self-reflection and measures. So answer is all of the above. So
great.
Let's move.
Okay, so let's hear from a DTO's personal experience, how they did the PDSA cycle.
Good afternoon, everyone. Sir, our aim is to increase the 10% public notifications.
The aim
That's
states.
our aim. So
Step one, remember.
we have a 10% price. So in April, May, June, we have a 234 cases and our target to reach up to the 257 cases. So we had started from the July, August and September. So now we are on the mid of the August. So it's going on. So as per our aim in Junagadh, we will increase the public notification by 10% by 3 months using our field referral, contact tracing, good quality SCF service. So for that, we have adopted a 5 strategy. The number of open cases referred by the health worker, referral from the OPD's data, as well as the referral from the community health officer, weekly ASA meetings, and high-risk area surveillance on every second and fourth Tuesday of every month. That is our process measures. For that, our outcome measures is number of cases notified on the next day. So our team, myself, my MOT sheet, DPC, PPM, STLS, and STS are the core team member. And with that, all the our districts have a united meetings, and we have an alternative days there. We have a Google meeting is also there. So my flow chart is like, I have to expand my IC at every field level up to the 1,000 population of the ASAs. I am as well as the passive surveillance. We are focusing on the active surveillance. We are showing our data in weekdays, June, July, August, September on weekly days, and all the 4 indicators what I measure and all that we are saying. So we are focusing on from the July first week, like 13th, every weeks on that. So some of the graphical representations, the number of suspect referral from PHI OPD.
Graphs are already made for you.
Our OPD data, in a 4%, that should be like that. So it's in an increasing manner. Our strategy has been adopt whatever the strategies following with this is 5 point is in a right manner, or we have to need any changes, any modification. But that is the one thing has been proven by our slogan. NTEP. I think no maximum number of the cases has been identified by our team. So it means it's a quality work going on in my district, as well as there is no backlog or no data. So we are in a truly sense moving toward the elimination of the program. Thank you, sir.
Great, great. So Dr. Vyas, let me ask you this. How did you find this whole process? Was it helpful? Was it tedious? Was it energizing? Great. So I want to thank our iDefeat project. I have not had a chance to mention them. I wanted to use this opportunity. This is a iDefeat project funded by USAID and Union, and they have been incredible. You see, learning has been built on many areas. We have not just done this learning on our own. We've credited IHI, Institute for Healthcare Improvement. Dr. Salil talked about his experience there. We have talked about also presenting this different places. NatCon, we have presented and learnings. And iDefeat project has been the next place where we have learned many things. And we are sharing those experiences, and we're thankful for that experience. And we have now scaled that up for the BTN project because there was an active and urgent need. So Dr. Pratibha, we've gone through a lot of materials for the DTOs, lots to digest here.
True. So I'll just say, with the help of quality improvement, I believe in TB harega or Desh jeetega. All right, people, then let's start. Let's do this. And with that, I will hand over back to Commodore Raman, and he will erase. Thank you.
Thank you, Dr. Pratibha. And before we do that, it is time for me to invite Dr. Lokesh again. And it is already 5:40 p.m. We have 20 minutes to go, because there is one promise, DTOs. We will always start in time and we will always finish in time. One thing we know is we respect your time, and your time is very precious. So at this point in time, I bring in Dr. Lokesh for 2 reasons. One is to give you the concept of our PDSA approach. There are many problems, DTOs, in our lives, in our professional lives, many. All we cannot control on our own. If you have a problem in, say, vacancy, there is nothing which you can do about it. You will have to go through the STO, the Central TB Division, the Government of India or the state government, and then get the vacancy. There may be some other problems that you may have of issues which are beyond your control. In PDSA approach, we only look at those problems which are within my scope of finding a solution. Now, if there is a problem which is bothering me, either I can sit and keep complaining, or I can find a solution. I bring in Dr. Lokesh because he found a solution for following up and for doing better time management and for doing the right outcome at the right time. Dr. Lokesh, 3 minutes, if you can kindly share your thought process and what you did, please.
Sir, I have developed one mobile-friendly app, which I am showing here. Okay, just a minute, screen.
So this is Conversation Innovations. As you can see, we are having our DTOs share their innovations. And so our DTOs jo hain, over 350 DTOs are here. You will also get a chance if you want to share some your innovations.
So, sir, this app is TBMB, which is fourth from the lowest row. This is TB Mukt Bharat. Now I will click it. The logo of NTP comes, a window comes. इसमें आता है choose one treatment. तो currently ये 4 तरीके की हमारी TB regimen चल रही है ATT में. Drug sensitive TB, H monopoly, shorter MDR, and all oral longer. Suppose I select all oral longer, then treatment start date is a calendar, forward and backward moving. Now, suppose we start the treatment today, 20th May 2022. I click OK. Now I will get the follow-up dates. So in this regimen, there is nothing like microscopy. So it is not applicable, is come here. And in culture, the forward coming dates till the 20th month are coming in advance. So it is a ready reckoner, जो advance में हमको dates calculate कर देता है. Similarly, for any regimen, we can get it. Suppose for H monopoly, we select the date of today and we get the follow-up dates. So microscopies 3rd month, 4th, 5th and 6th months पर जो future dates होंगी वो आ जाती हैं और culture जो dates हैं वो आ जाती हैं. So what is the use of this? Basically, this is a mobile friendly app. कुछ अलग नहीं है. सिर्फ जो चीजें हमारी डिफाइंड है प्रोटोकॉल्स में उनको एक रेडी रखना है. दैट इज अगेन एन एग्जांपल ऑफ क्वालिटी इंप्रूवमेंट. आई वुड लाइक टू से एंड शेयर डॉक्टर रमन सर हियर. जो फॉलोअप से हमारे टाइमली होंगे, तो फॉलोअप टाइमली होने से सबसे पहले तो चेंज ऑफ रेजिमेन अगर हमारा कभी होना है तो हम पता लगा सकते हैं, या आउटकम उसका जो रियल आउटकम जाना है वो हम पता लगा सकते हैं. मैंने जब से इस पर वर्क किया है और पीडीएसए के कांटेक्ट में आने के बाद आई वाज आस्क्ड कि इस पर वर्क कीजिएगा आप. सो पीडीएसए साइकिल को यूज करते हुए जैसे हमारा सक्सेसफुल आउटकम में 2 चीजें आती हैं, क्योर रेट एंड ट्रीटमेंट कंप्लीटेड. सो प्रीवियस डाटा से मेरा ट्रीटमेंट कंप्लीटेड का डाटा रिड्यूस हुआ है, क्योर रेट बढ़ गया है. इट गिव्स एनहांसमेंट टू द क्वालिटी. अदरवाइज फॉर ईच एंड एवरी फील्ड वर्कर, हर व्यक्ति को इसका बहुत बेनिफिट हो रहा है. जितने मेरे एलटीज हैं, एसटीएलएस हैं, इसके आगे हम ये करते हैं, जो फ्यूचर डेट्स हैं मरीज के ट्रीटमेंट कार्ड पर, मरीज के आईडी कार्ड पर नोट कर देते हैं इन एडवांस. सो मरीज को भी पता होता है कि उसको कब क्या टेस्ट कराना है. आई एम गेटिंग गुड रिजल्ट्स. Thank you.
Thank you so much. Thank you so much. This is example of innovations within there. So Commodore Raman, we have gone through a lot of journey here. That for the last leg, tell us how and why of teams. Take us through some processes.
Okay, so I'll take you DTOs very shortly through the process of the teams. And before I do that, it is very important for me to give the credit to Bruce Tuckman, whose concept I am going to share with you. His credentials are on the screen. He was a naval officer like me, but he did his studies in psychological literature also on team dynamics. And his concept has been improved, modified over the years of time. So how do we form the team and how do we work with the team? First is depending upon our objective, which is PDSA for TB notification. We will form the team, which we will help you that if you want to work on private notification or on public notification, who all should be the members in your team. Thereafter, the first step is forming, in which we will discuss about what is to be done, what is my objective. We will bring the various members of your TB team. We will get used to them. And it is very important at that point in time to select the team most properly. Thereafter, we will go to the storming stage, where we will brainstorm on how to improve my TB notification. Those procedures also we will let you know, which are the solutions which people have practiced. And as Dr. Manoj said, we will give you so many examples of the DTOs from amongst ourselves who have crossed the problem and the hurdle and have reached a solution. All the things that we discussed with you that Dr. Pratibha mentioned, about the 5 why analysis, how to find out the root cause of the problem, we will get there and we will form a team which will be multidisciplinary. We will know what are the points on which we have to work. And we DTOs together will start working on those points. At this point in time, you will face some problems with your teams. We will appreciate those problems in advance. And we will prepare you currently along with that. Many such examples like Dr. Lokesh shared with you of innovation, we will share your examples also. We have 46 such examples from across the country out of 150 DTOs that we have interacted with, who have found solutions on their own without going beyond their own authority. So we also publish a newsletter in which we will publish your success story. After storming, we will then come to the norming stage, which will be the state of equilibrium. The initial hesitation, the initial apprehension will be gone and your team will start working effectively. You will then take a state back. We will be making sure that your team is running. You will be able to automatically see it on your computer screen. You will be monitoring it. How is the progress happening? Which team member is working hard? Who is not working so hard? Without any conflict. Yes.
Yeah, so very much so you were saying. So we get into this norming stage and the words are replaced. We use the word we and us instead of me and I. I think those are important steps that happen as we begin to form those teams and norming stages.
Absolutely, Dr. Manoj, because this is the development which is going on. Once the team attaches your vision of increasing TB notification to its own dream, when your team takes the ownership of your dream and vision, they stop saying I. We start saying we. So that is the beauty. And then we will start performing. The synergy will come in. The team will become self-directed, oriented. Team members will start supporting each other, and then we will enjoy each other. But let me come in the last bit. How will we make the team and how do we select the team? It is very important to know what kind of team members are there in every team. So here is one nice video to close the topic, and then we will introduce you with our team.
There's a performer. And there's an effective doer, the helper there. And there's a less effective doer.
So I'm muting it and taking it fast. Here is a person who is a trouble source keeper. He's troubling. You know, his contribution is not being seen. He's riding along with you. There are few worse who are dragging you behind. He's trying to destroy the operation. He's pulling the team back all the time, showing that he's working. Not only that, he will disturb others and he'll hurt others. So there are all kinds of people in the team. We have to understand whom do we want. So, and then after the team is formed, the mission is accomplished, it will be time for us to break our team. We will say bye to each other on 31st of July after accomplishing our dream. And with this, I want to introduce you, Dr. Manoj, may I request you to introduce the team, our team, to the DTOs.
Absolutely. I think it's really important that our DTOs know who's behind all of this work. So Commodore Raman, if you would introduce them, that would be wonderful by name.
Okay, so we have the team leads whose names are in front of you, and with them, there are our counselors. They are the ones who are in touch with you and who are going to be at all times contributing to your effort. Single window contact for you. They will be moving along with you and your team while you are undergoing the journey of PDSA. Whatever doubts that you may have, whatever query that your team may have, we will make sure that they are resolved. We will make your teams technically and technologically qualified so your efficiency increases. We have these wonderful counselors from 16 universities across the country speaking all languages. So if you have a problem in language, we will make sure that we pull out a counselor who will be able to support you. We have 62 such counselors to assist you. Anything from your side, Dr. Manoj? There are 5 minutes more.
Sure, absolutely. If you wouldn't mind putting the slide, which is what to expect graphic again. We will finish with that. But I really want to have our DTOs be well aware that aapke liye, aapki madad ke liye, the counselors are there. Please pick up the phone when they're calling. Please text back if you're busy to say that you will call them later. They are there to help you in this process to increase the notification. And so here is our thinking and process and engagement for this first session. We have shown the importance of team. We have shared with you the quality improvement tool. What are the expected outcomes? All of you have monthly data. Begin to look at your monthly data in this very format. Look at what has happened to notification, and then make a promise to yourself that you will increase notification to 2019 level and beyond. You know you can do it. You know it was being done. Let us work on doing that. So Commodore Raman, we are ahead of time. We greatly appreciate so much conversation from our DTOs. So over to you.
Thank you. Thank you so much, Dr. Jain. And it is just 2 minutes to go for us to close the program. All I have to say is that first is thank you, Dr. Lokesh Gupta. Thank you so much for being present here. I can read your chat. We will respect your time at all times. And these counselors are most energetic, potential, wonderful people who have been putting a lot of hard work in trying to understand the problem of the TB program. They are there, they have experienced the PDSA, They will give you a call. We will respect them, and they will gain your respect. And make sure that if something is beyond them, team leads are there. If something is beyond the team leads, the faculty is there. We are there. But we will make sure that your problem gets resolved. We are fully aware of the TB program. We have been through the PDSA process. It is our own process. It has not been imported from anywhere. So that is the reason we are talking with conviction. Yes, you will get all, I am reading the remarks, you will get all the PowerPoint and recordings of whatever sessions we have. Yes, you will get to have the access to this app. Please get in touch with your counselors. He is your single window. She is your single window. Whatever you need, your counselor is the answer. Please save their number. Okay. I have told them to make sure that they connect with you, they bond with you, they network with you, treat them as your family members. We will do it together. And with this,
Absolutely.
please switch on your videos.
Great.
Yeah.
Yes, and yes, please switch on your videos. Dr. Salil, any final remarks and words from you as well? As you have been through this process of being a DTO, you have been through the process of doing many PDSA cycles. And
मनोज, मैंने जो सवाल पूछा था कमोडोर रमन से कि क्या आप हमको कोई नई चीज बताने जा रहे हैं, नाउ आई एम कन्विंस्ड कि शायद हम अगले कुछ महीनों में हमारे डीटीओस को कुछ नया बता पाएंगे, उनको ऐसी चीज सिखा देंगे कि जिससे उनकी जो डे टू डे एक्टिविटीज है उसमें वो बेहतर तरीके से कर सकेंगे। मेरी रिक्वेस्ट सारी डीटीओस से है, प्लीज टाइम से ज्वाइन करिए एंड प्लीज स्टे फॉर द होल पीरियड विद अस। आप हमारे साथ रहेंगे तो आपको समझ में आएगा हम आपसे क्या बात करने जा रहे हैं। एंड आई सॉ लॉट मेनी ऑफ यू हैव जॉइंड, but few of them got disconnected, but please continuously stay with us. Thank you to the whole team. मनोज, बहुत मजा आया और मेरे ख्याल से पक्की बात है कि हम लोग, मैं इस प्रोजेक्ट को ऐसे लेना चाह रहा हूं मनोज, टेक ऑफ फॉर मिशन 2025। हम इसके टेक ऑफ की तरह इस प्रोग्राम को मैं लेना चाहता हूं और आप सभी डीटीओ से मैं रिक्वेस्ट करूंगा कि अपने जिले में जैसे शंखनाद करते हैं टीबी फ्री जिले बनाने का, वो करिए प्लीज। Make a noise कि हम अपने जिले को टीबी फ्री करने जा रहे हैं। Over to Manoj, please.
Great. So DTOs, please turn videos, and thank you so much. And we are looking forward to seeing you again next Friday. And that's when we begin our aim statement. And there are resources आपके counselors share करेंगे that you can read on all of this information. Over to you, Commodore Raman.
Thank you. And my advice to the counselors, please make sure that you now establish the contact with your DTOs, become friends, become family with them, network with them. They should feel awkward if a day goes by and you have not spoken to them. Okay? They should feel awkward. That is the word I'm using. Please tell them that, see how we stick to the time. It is not like an Indian stretchable time, IST. No, we will stick to the time. So they must join and we will make sure that we close in time. And it is time to close. So all the videos on, wonderful smiles on. DTO Rohtak and Dr. Javed. I could not take your questions today. I promise you will take it next time. Thank you so much.
Thank you,
Dr.
everyone.
Jain.
Wonderful.
Thank you,
wonderful,
Dr. Salil.
wonderful session.
Thank you, Dr. Pratibha. Thank you, all the DTOs, all the QICs and the counselors, the staff and the IT consultant for CTI.
Wonderful. Thanks, everyone. We'll see you next Friday, 4:30.